Welcome to the CommQuest Hope Discovered podcast. My name is Tom, and I am the Director of Withdrawal Management and Residential Services, and I'm here with Dani, who is my boss, and the Senior Director of Residential Services. Our subject today is going to be hope and healing conversations on substance use disorder treatment. Dani, one, welcome, and two, can you explain to us a little bit what substance use disorders are?
Yeah, absolutely. So a substance use disorder is a medical condition. What we've learned in recent years through research is that it is a brain disease. So just like any other medical disease, cancer, diabetes, heart disease, it does have similarities there. It results from the recurrent use of drugs and alcohol, resulting in some type of significant impairment in some aspect of a person's life. So that can be, someone's day-to-day functioning. It can be impairments in their social relationships, in their work duties. That's key. There does need to be some type of impact. It also affects aspects of the brain's reward system, decision-making, and impulse control. It is a progressive disease in nature, meaning that it does get worse without treatment. And it varies in terms of levels of severity. So it can be mild, moderate, or severe, depending on the consequences or the problems that arise from someone's use. I would say, the most important thing to keep in mind is that it is treatable and it does get better with the right support.
Absolutely. And kind of like with many others, if not treated and left undone, it can sometimes unfortunately lead to death. So Absolutely. With that kind of in mind, what are some of the barriers that keep people from getting treatment?
Yeah, I think some of the main things that come to mind for me are stigma. I think it's associated with addiction, maybe more so than physical health conditions, just because of kind of some of the early underpinnings of what we thought addiction was, which was more so a problem of willpower, just bad decision-making, personality issues. And, as I said earlier, with the research and advances in what we know, we understand that not to be the case. However, when there is false information out there, it can be difficult to rectify, and that does take some time for that to change. I do think that with more education about SUD, with more, media campaigns, with more, support from people in spotlight positions that have come out and shared their story, I do think that stigma is abating. I think we're seeing less resistance to people that are identifying as having a substance use disorder, which then in turn results in more people accessing treatment. But it certainly still is there. And sometimes it can be stigma associated with specific areas of life. So work, for example, if I go into treatment, if my employer finds out, then what are they going to think of me? What are they going to think about my capabilities or abilities at work? Another area that is a barrier that we've seen more recently is lack of access due to financial limitations or insurance constraints. So at one point in time, if you were a resident of a particular county, generally, if you sought treatment within that county, your county mental health and addiction board would cover the cost of your treatment. However, with changes in managed care, particularly over the last 10 years or so, it is more specific to your specific insurance plan. And we know that those vary widely. So it can be difficult to, number one, really understand what that means and what that looks like for you in terms of access to care, but then also in terms of the provider, what is the arrangement that you're willing to work out with someone, that you can work out with someone in order for that person to get treatment. And all that can be very complex depending on, again, the insurance company. There's also been barriers in terms of length of stay. So length of stay is traditionally has been, close to 90 days. However, more recently, it's become a lot shorter than that. And, there's definitely been some criticism as to whether, it is enough treatment for folks. So those things are definitely barriers. I will say that one of the really great things about CommQuest and being a nonprofit is that we really try to work with that individual to get them into care. And we do our absolute best to do all of the all the things that we possibly can. We have a financial enrollment specialist on staff that really works on the ins and outs of insurance, getting people signed up for insurance, working with the board in cases where that's applicable to get someone's insurance covered, working out financial payment plans that make sense and are respectful to the individual at hand. So we really pride ourselves on being able to meet the needs. And one other thing too that can kind of be a barrier is mental health concerns. So if somebody is struggling with addiction or depression, it can kind of complicate things, which then in turn complicates their ability to get into treatment. So if I'm a person with anxiety, I might just have a fear of talking to people. So it's going to be hard for me to pick up the phone and make that call or present in person, or, be really intimidated by the experience of being in treatment with 10, 15 other people.
Absolutely. And with all the change and everything going on, how has CommQuest kind of evolved in recent years, especially with like medicated assisted treatment and other things like that to kind of meet those needs?
Yeah, I would say in general, treatment has become more evidence-based and person-centered in general. And you mentioned medication-assisted treatment. So that combines FDA-approved medications with counseling and behavioral therapies to help support the person from a holistic standpoint. I think that's another kind of big buzzword is holistic care. So really looking at the individual as a whole versus just treating, that one specific pocket of impulse control or use and trigger, right? So it's really looking at other aspects of the person that make them well. So physical wellness, emotional maturity, spirituality, social support, the ability to, have fun in recovery. So looking at all those things now in terms of someone's integrated care and treatment plan have become more so a standardized version of care in a sense, right? I would say with that as well, integrated care. So being able to treat someone's mental health conditions and substance use disorder at the same time, versus historically those things were seen as being separate and they were treated separately. But we know that the most effective treatment and the best shot at recovery is looking at those things together and being able to understand how they coexist. One of the other things that I think has been really popular since COVID as well that's helped people with access is telehealth services. So this is particularly advantageous for people who may lack transportation or have mobility issues, or again may have a lot of anxiety and maybe are not comfortable leaving their home. It just kind of increases access to services that in the past they may not have been able to attain based on those limitations.
Absolutely. And so with some of that being said, what are some of those things that as you're looking at different people and populations, what are some common misconceptions about people with a substance use disorder and in particular about substance use disorder treatment?
Yeah, I wrote down a few that I hear a lot. So that it's one is like a moral failing rather than a medical condition. We talked about that a little bit earlier. So it's more than just making the decision to not do something and stick to it, but it is a disease just like any other. And without really understanding the disease and treating it with the right components, it's not going to get better just by sheer willpower. That people must hit rock bottom before recovery can happen. We know that that's not true. And, research has shown that the earlier that people catch the problem, the more likely they are to, avoid escalation of use, escalations and problems related to use, and have a better shot at recovery. Another one is that treatment only works if someone has strong willpower. We've kind of already talked about that. And it's more so about, helping that person really understand what is going on for them and helping develop their own level of motivation and their own reasons, their own why for getting better. Another one is that relapse means failure rather than a potential part of recovery. So that's, that's a big one. And I think that one can be very demoralizing for people who have been in treatment and maybe have even been sober for a significant period of time and then come back in. But we know that, oftentimes it takes multiple tries in order to establish long-term recovery. So just knowing that if that does happen, it doesn't mean you failed. It doesn't mean that you're starting back from where, day one. It just is, it's something to kind of process and understand in the entire context of someone's recovery timeline. And the other one is that one type of treatment works for everyone. And again, as we talked about earlier, it's been one of the, some of the changes and more of the advancements in care is that that's going to look a little bit different for each person because everyone presents with a different set of issues, be it, mental health, be it trauma, be it social cultural context. There's just so much that goes into what makes a person that their treatment must reflect that as well.
Absolutely. And I think that when we look at it, one of those things that definitely that pulls a lot of people away from being able to do it is, and you brought it up earlier, is this idea of stigma and that fear of people looking down upon you and that fear of, hey, what was my boss going to do about it and stuff. So what kind of things are we doing to help people get over some of that stigma or get around some of that stigma to get them into the doors to treatment and stuff like that?
Yeah, again, as I said, there's been a lot of movement, and I would just say with, kind of local mental health and addiction recovery boards to get information out there, to get, media awareness campaigns on social media, on billboards, on buses, just to get out there that, there's a lot of people that are really struggling with this from all walks of life. It's not isolated to any, specific demographic of people. It can affect anybody at any point in their life from any background. So I think just people knowing that they're not alone, I think that's a big component, is that understanding that there's other people out there like me. And that, again, that hope piece is really important, that if I do the things, if I make the next right steps to get myself into care or contact someone that can lead me in that right direction, that it will lead to recovery, that it will lead to a better, happier, brighter life.
Absolutely. And I have the conversation regularly with people that when it comes to the disease of addiction, it's not about the fact that you're a bad person or a bad moral failing or anything like that. The disease of addiction doesn't care what race you are, what gender you are, what sexual orientation you are, what socioeconomic status you are. It is truly non-discriminatory in any way, and it can affect anybody at any point in time. Even people we've had come through, I know, and I think you can attest to this as well, is that people come through even later in life that didn't have issues with it and were very successful early in life, then develop it later in life. And that's part of that stigma that a lot of people don't see, is that it's not a clear-cut, dry thing that you're a bad person if you struggle with this stuff. So as you're looking at this and as you're a family member and you're like, well, my family member doesn't fall into this box per se of what this person is, how can families kind of help start to identify with or even work on supporting a family member that they feel might have a substance use disorder?
Yeah, I think the first thing, and you kind of said it, is just to be open to learning about the disease of addiction and being able to educate yourself on myth versus fact. And we've talked about, some of those things already in terms of some of the common misconceptions. There's just really so much education out there. I mean, you can go onto YouTube and find some fantastic videos about addiction as a brain disease. And that tends to be a really eye-opening thing for people because it is tangible, it's objective, it's evidence-based. So just being open to changing your way of thinking, particularly if you've been someone that's had some misconceptions about substance use disorder or people that struggle with addiction, just being open to changing those thought patterns. I think it's also important to just start by listening to your loved one or your friend or whoever that person may be in your life that's struggling, and just listening without, any sort of judgment. And also listening without feeling the need to feel like you need to problem solve for people, because in reality, people have to help themselves first, and they need the support of qualified professionals to help them along that journey. So realistically, there's not anything that you're going to say that's going to be like a problem solver for someone. And usually when people are coming to us to talk, they don't really want that either. They just want somebody to listen, somebody to be present, somebody to be in the moment, and just to acknowledge that, hey, I'm here to support you. Like, how can I support you? What can be some things that I can do? What are our next steps that maybe we can do together? Can we maybe make a call together? That's really important. I think one of the big things too is setting boundaries with that person in addiction. Being able to make certain rules for yourself, set limits around your time, your energy, maybe your place of residence, and sticking to it. Because we do know that one of the things that's helpful in treating addiction is being consistent with rules and boundaries and holding people accountable to that. And, that can be really, really hard, especially if you're close to that person. So if you're a parent, I mean, my goodness, it's so difficult to do that with a child because you love them and you just want to, in that moment, make things easier for their life. But that's not always the best thing for them in terms of their long-term recovery. So with that said, I think something that's important for people to keep in mind, especially if this is somebody that's very close to you, is getting your own help and treatment. Like, you can get counseling for the stress that might create in your life too. So knowing that you need to be taken care of as well, and your mental health is just as important in that situation as that person's substance use disorder.
Absolutely. And tough love is still loving, even if it's not necessarily seen as love by the other person, especially the person in addiction that's trying to tell you that
in that moment. And, I think, having, working on the end that we've worked on, and I think this is helpful for anybody out there that's listening when it comes to like their family member, is we will have clients say, I can look at what my mom or dad was doing now and understand that they were just trying to do the right thing, that it wasn't that they were trying to be mean or that they, were trying to inflict some kind of pain or whatnot. It's that they were trying to do the right thing so that I can do the right thing for myself in order to get better, so that I can start to break some of these habits and not, not be in a situation where, what's the word I'm looking for? Codependency. Yes. Or to get kind of involved in that kind of whole dynamic. So,
or even given into the manipulation that they're trying
Correct.
to, that the addict is trying
Correct.
to impose upon their family members.
So I think that's really important, that people do get to that place and they are able to develop that level of insight once the effects of kind of that drug use wear off and they're able to really process what's going on.
Absolutely. And then, so you kind of brought it up a little bit there with family members seeking help and stuff for themselves. What kind of resources are available for those who are looking for help? Not only for the family members, so what kind of services are available and what kinds of things are available to people who are looking for help, who have a loved one, but also what kind of services are available for those who have a substance use disorder, who need help stopping their substance use? What kind of services are available?
Well, again, I think services run the gamut in terms of medication-assisted treatment. It can be counseling, depending on, again, going back to the first point, depending on the severity of someone's use, that kind of dictates the level or intensity of care that person's going to need. So, if you're more on the mild end, your treatment can maybe be more well managed at a lower level of care, meaning outpatient care. So you can stay in your residence and then go to counseling once a week or multiple times a week in order to treat your substance use disorder. Whereas if things have become more severe and you really can't function outside of a controlled setting, then something more like an inpatient setting would be more appropriate. So I think that's something important to keep in mind, is that, again, it's not a one size fits all kind of approach. And you aren't necessarily, you as a person aren't necessarily responsible for knowing what that looks like, because that can be like a little bit overwhelming, I think, is to try to figure that out. So wherever you're going to seek help, we'll give you recommendations based on where you're at, and we'll help you guide you in the right direction, based on the severity of your use and other components in your life as well. So again, I think it's just being able to kind of make that initial call, and then the rest will kind of play out from there. So, but again, there's multiple components to treatment. So there's also a social support component. There are various recovery support organizations in the area, as well as a plethora of self-help group meetings, which are really advantageous for people. And that runs the gamut from NA, AA, Celebrate Recovery. There's some that, are kind of very secular as well, just depending on what your level of spirituality or lack thereof might look like. Especially in this area of the country, there's definitely a wealth of support groups. So I would say, if you really don't know where to start, I would reach out to your local mental health or addiction recovery board, who can kind of give you some initial resources, some referrals of where to start, and then start making the calls from there. And you will be able to find a place that can meet your needs.
Absolutely. And as the director of Withdrawal Management Services, I have to put a plug in there for
absolutely.
Withdrawal Management Services. For those, is that some of our substances that are out there, I was specifically thinking of those like alcohol, benzodiazepines, and some others that can be very dangerous actually to come off of. And it's one of those things that as someone your family member or loved one might be trying to come off of one of those types of substances, or very difficult to come off of, like something like an opiate, like fentanyl or something like that. It can be very difficult to come off of those. And so they might need some help, especially at the very beginning of it. And so we have Withdrawal Management Services, which has also been known as detox in the past, that we can come and do short-term detox and stabilization for people to be able to help them be able to stabilize from their withdrawal symptoms, and then connect them to the appropriate level of care and appropriate services that Dani was talking about earlier.
Yeah, and I think detox is often a very common first step for people who are faced with addiction, especially if you're in more of that moderate, severe pocket. If we're looking at, services or access to services, one of the really great things about CommQuest is that we do offer a very wide range of services for individuals in the community. So anywhere from, early childhood intervention to school-based services to outpatient counseling, detox, IOP, medication-assisted treatment. We offer psych services if you have mental health needs. And then, things like social support, things like case management, peer support, employment support. So again, all of those other components that play into integrated holistic care, we have as well. So it's really a nice one-stop shop for people who are looking to make a big impact on their lives.
Absolutely. And so what message would you share, Dani, with someone who's maybe hesitant as they're listening to this to seek treatment at the moment? What's something you would like them to know?
Yeah, my message is that you're not alone and that help is available. Seeking treatment is a sign of strength and not weakness. Recovery looks different for everyone, and it's okay to take the first step at your own pace. Support, compassion, and effective care exist, and you deserve them.
Very well said. Now, what about for the family members who or caregivers of those that are struggling with a substance use disorder, or even someone who's in recovery? What are some self-care tips for them? What are some things that they can do to help take care of themselves?
Yeah, and I think we've hit on a little bit of that with boundaries, but I think another component that kind of piggybacks off of that is not being responsible, or not feeling responsible, I should say, for someone else's recovery. So whether someone is, taking the steps to enter treatment or to stay in treatment, or the gains or lack thereof that they might be making, is really not an extension of you as the support person. So knowing the limitations in realistically what you can do for someone's recovery, because you can't do it for them. They have to make the decision that it's something that they want for themselves, and be committed to doing the things that they need to do to follow that decision through, again, with the right support, with the right treatment, and with all of the components that make recovery possible. And again, a part of that kind of larger integrated support network of care is the family. So understanding how setting boundaries, how setting limitations can help someone in their recovery. I would also highly suggest family counseling in those situations. Again, especially if someone's going to be living with you, especially if there's, kids involved and there's maybe a parent, child, grandchild sort of dynamic. Family systems are really complex and they affect an individual. Like, we don't exist in isolation of our family system. So it's so important to be able to come together as a family and identify, not only some of the things that were happening that may have contributed to that addiction or sustaining that addiction, but also like, what are the strengths that can help someone in their recovery, because family support is so helpful to have if it's done in the right way. So that's the big thing. I would also say just, practicing stress reduction techniques. So things like, eating healthy, exercising, mindfulness practices, breath practices, having your own life and your own interests and your own, things that make you happy, and not, being able to do those things in conjunction with supporting this other person, so that your entire life doesn't just become helping this individual in recovery, but that you have your own life as well.
Well, I wanted to thank everyone for watching the Hope Discovered podcast with us. We thank you for joining us here at the Deliverance House here on the Maslin Recovering Campus here in our new facility. We want to thank everyone for making it possible for us to be able to be out here at this new facility and everything that made this happen. Thank you so very much.